products that we deliver are about transformation of health and care. It's not just tech for the sake of it. We've been on a modular approach and an incremental approach. More recently, we've implemented electronic prescribing and medicines administration. It was pretty much a textbook implementation. It took about 9 months to deliver our inpatient wards. We introduced mobile working through computers on wheels. But in the recent past, we've decided that to use real innovation, we needed to give clinicians more of a utility. And the concept of workstations on wheels, or WOWs, is something that's been quite a revelation in our work. The products that we use now are really transforming the clinical care for our patients, having access to all of those digital services on a large screen, on a portable device that's got long battery life, is really creating a difference for the patient care that we provide.
As CCIO, I've been closely involved with the ePMA, or the e-prescribing project in the trust. One of the functions, if you like, of this program is to replace our older paper-based cardexes with an electronic system. The biggest advantage by doing that is that the prescriptions are now visible to everybody. We can wheel them right by the patient's bedside, quickly view their observations or x-rays or prescriptions, and then make a good, safe clinical decision, which might be, changing some treatments or early discharge.
Join the team from a nursing perspective around quality to ensure that whatever system that was going to be placed into the ward areas, that it was suitable, it was easy to use, and how accessible was it going to be to nurses. I needed to make sure that they were easy cleanable from an infection control point of view. I needed to make sure the fact that they weren't so big, so they were easy to move around within the ward areas because they're quite tight. And the screens needed to be a certain size, so even at night that it was easier for them to read the writing on the screens as well.
So as part of the ePMA project, a hardware audit was used to identify a number of devices, and from this the Parity WOW workstation on wheels was identified as the best solution. The Parity workstation on wheels was chosen due to its unique design, having the medicine cabinet at the bottom for nurses to have the medicines along with the computer on wheels was absolutely ideal. You also had the ability to lift and raise it, so you've got that height adjustable to obviously protect the staff as well from back injuries.
Ward 42 staff were quite apprehensive actually about the mobile carts and the introduction of ePMA, but now it's here, the staff really like them and find them really beneficial. The medicine ward round times have been significantly reduced actually, because we're not looking for medicine cardexes. The staff have found them much easier than a traditional medicine trolley. They're much lighter, we have staff of various sizes, so they adjust to that.
We've been using the Orion remote software really to help us manage the devices that are out on the wards, and the big advantage is that we don't have to physically go there. We can do it remotely, so we can check the battery levels, we can look at the CPU usage, and then the nice thing about it is we can look at problems proactively rather than reacting to what's going out there, so we can try and get out there and solve problems before they actually happen.
One of the great features of Orion is having the ability to customise the dashboard, allowing us to get a live summary of the status of each mobile device at a glance. We can monitor battery charge levels, device location, hardware status, all from a single customised screen. And it's all managed entirely remotely, so we don't have to visit each device to pull a diagnostic report. So you can imagine how much time this saves us, considering the amount of devices we have across our sites.
We were really happy with the support we received from Parity, which helped us have a successful phased rollout.
The carts are really easy and really quick to clean. We just use the Clinell wipe, what we use for all other equipment.
Everything's in real time, and the benefits around patient safety, timely administration of those drugs and services, and a better experience all round.
From the nurses' points, the having the medication box attached to the Parity valves has been excellent.
They've definitely had a massive positive impact in helping the Trust move forward with regards to going digital and paper-light.
The return that we get may not be absolutely cash releasing, but when we get more time for nurses, for example, to care for more patients, that in itself is worth a lot.
The Parity Medical Group have been excellent with the ward, the training was excellent, the staff have found them really user-friendly, and we would never want to go back to our old practice. We're really happy with what we've got now.
It's incumbent that we work with the right supply partners, such as Parity Medical. Their role in this direction of travel is mission critical. They can provide solutions to the problems that we have, and they can also learn from organisations like ourselves, so they can then share with other organisations in the health and care system.